Hello, everybody. And now we're going to talk about our topic of the day, which is the art and science of case taking and case giving. And the reason I'm talking about this is you have all, down to a person, talked about issues that you've had, things that have happened to you. But it's important to understand that there is an art and a science to describing how you feel. And in homeopathy, it's very well defined, and it can apply to everything in your life. It can apply to your cough and cold. It can apply to your joint pains, your acute sickness, your cancer, your chronic disease, everything. And the way you articulate it matters, because when you look at those symptoms in something called the repertory, you're going to be greatly helped in getting to the right treatment, getting to the right remedy, whether it's an allopathic or homeopathic doctor. So I think this is good discipline. And so we'll talk about the art and science of case taking and giving. Ask me questions, please, as you go along. And we will take it from there. I'm pretty sure it's recording. Yeah, let me just confirm one more time. Yes, it is recording. Okay, now we go to the next slide. Everyone heard of the word materia medica? Has anyone not heard of the word materia medica? I will tell you what it is. Materia medica is a description of a drug or a remedy or a medicine in just all of medicine. So this is an example of a homeopathic remedy called arsenicum album. And what this materia medica is describing is how the arsenicum album works. So for instance, it'll tell you anguish and restlessness of the mind, restlessly moving around, fears of death, of being left alone, great fear with cold sweat, and so on and so forth. It goes to the mind, the head, your stomach, your kidneys, your extremities, and so on. And so it goes organ by organ, from top to bottom, inside and out, and describes the remedy symptoms which you will experience with this remedy, which is where it corresponds to your particular condition. So if you have great anguish and restlessness and a fear of death or a fear of being left alone, arsenicum album is a terrific remedy for you. If you have headaches that are relieved by cold, and periodical burning pains with restlessness, this is an excellent remedy. And rather than, thinking about what to do and all that, learn, I would say, to read the materia medica. It sounds daunting and seems daunting in the early going, but you can find a cheap one online or free. There's materia medicas that are free online. You can find cheap secondhand books that will allow you to look at these remedies to see, is this right for me? Is this remedy right for me? But why are we doing all this? Can anyone guess why we're doing all this? Give me a guess. Someone unmute yourself and tell me.
For our health.
Maria, yes?
For our health.
For our health, to take control of our health, to take charge of our health, because these are remedies that will not harm, they will only help. They're very, very dilute, they're not toxic, they have no side effects. So think of homeopathy as vaccinations that are amazing, as opposed to their evil twin, which is the vaccinations that cause a lot of damage. Both respond to or affect your immune system. One of them, the vaccine, suppresses your immune system, and homeopathy engages and elevates your immune system. So homeopathy works with your body to get you well, and you see miracles. I've seen some miracles with that. So that's the materia medica, folks. And then there's a second thing in homeopathy called the repertory. Repertory, this was about remedies. This was about the drugs or the medicines, the materia medica. And the repertory is an encyclopedia of your symptoms. So a very good way to start is with a repertory and not with the materia medica. And the reason is, you know what you're feeling. If you're a very sensitive person, if you're very sensitive in the evening, you see this, there's only one remedy, Calcarea carbonica. If you're very sensitive during a chill, the right remedy for you might be capsicum. If you're a very serious person, any of these remedies could be right for you. And if you're serious in the evening, Seneca is a great remedy. If you're a sentimental person, if you get sentimental during diarrhea, there's even specific rubrics which have literally one remedy, which takes all the guesswork out of thinking. So if I had diarrhea and I suddenly got very, very sentimental, and Richard knew a little bit about homeopathy, he would look it up and say, oh, she's very sentimental. She's also got a concomitant diarrhea. This is antimonium crudum. Let me look it up in the Materia Medica and see if it generally matches Sushima's state. He would never do that, but that's an example. And he would give me antimonium crudum, and I would perk up and my diarrhea would get better. So these are great clues to very specific individualization of remedies for your symptoms. And that, folks, is how homeopathy, it's like the biggest science of all medical sciences. There are tomes and tomes of stuff written on every remedy and all kinds of repertories that have incredible information. Questions? Any questions?
Yes.
Please.
Yes. There's a long list of items in repertory, and I'm wondering, do you take as a provider or as a homeopath the one that has the most, or that seems to be the most powerful? Because there are a lot of qualities that are affecting all parts of the body.
Yes, it's a very good question. So what you do as a homeopath or as a human being, regular human being, and the reason we're learning homeopathy, folks, is because it's people's medicine. It's your medicine. If you learn to use it well, you will not land in hospital like she did and have the problems that she did and have to ask someone to come and do it for you. It will be like that in your head, and you will benefit greatly from it. You'll get out of hospitals in half the time that you would ordinarily spend there. And so to answer your question, say sentimental, there are these 1, 2, 3, 4, 4, 5, 25 remedies for sentimental. And out of these, you look to see what sort of sentimentality is it? What's the other symptoms that this person has? It could be sentimental with a headache. It could be sentimental right before your periods. And that specifies it, that narrows the funnel down from all these remedies down to antimonium crudum. If you're sentimental when it's full moon, antimonium crudum. Who knew? So what you're doing is you're taking from the repertory these symptoms that you have. This could be a skin condition. This could be a kidney condition. And you repertorize, you take these 25 or 4 or 5 symptoms. Don't take too many symptoms. Just take the 4 major ones, the most important to your life. Put the remedies next to them. And then any remedy that's common to all those symptoms is your remedy, provided you have given some thought to what that remedy is. And that's the way to learn. That's the way to learn the homeopathic materia medica and the repertory. Questions?
Sorry, a brief question. I have a materia medica online that I've chosen that's free, but I've never, this is just my learning, never seen a repertory. Is that a separate document, or do you find that separately? How does that work?
Yes, yes. So let me show you what a repertory looks like. This here, can you see this? This is a repertory. This big fat book with the index is a Kent's repertory of homeopathic materia medica with a word index. So what you do is you go to this tab. So I have a mind issue. I'm feeling really sad. You go in here, look at this, look at what kind of symptom, particular symptom the sadness is, and you go to the next step. I was weepy after I had COVID. I don't know why. And for me, pulsatilla was the remedy. It immediately helped me heal whatever it was that was ailing me. I don't usually weep at all. But after I got out of COVID, I was like, "Argh, I'm gonna miss my grandson. I'm not gonna see my daughter. Wow, wow, wow." I would never have cried ordinarily. So it was the direct effect of the debility of the disease, of the illness, and pulsatilla worked. This is a materia medica. You will see that this is a materia medica of mental symptoms, and it's got various things like calcarea carbonica. What are the mental symptoms of calcarea carbonica? There's materia medicas with full symptoms, mind, body, everything. So I have a physical book. A physical book is useful when you don't know what to look for. If the repertory says sentimental and you're thinking emotional, you gotta know that you gotta look up sentimental, because these repertories were written 100 years ago. Even if they were not written 100 years ago, Karen, you have the Robin Murphy repertory, which is more modern. You're still going to need to, it's a good idea to have a physical repertory, to go through it, say through mind and say, okay, it's sentimental, emotional, weepy. So you know what to look for in an online repertory where you can only put in words. Does that make sense, Land?
The secondary question, but are there ones that you prefer that are more accurate or more helpful, or is that kind of just the panoply of what's available?
I like the old masters materia medica. Some people like the newer writers. It's up to you what you're comfortable with. But the newer ones are people like Robin Murphy, who in this century, they 80s, 90s, these were written. Kent was written over 100 years ago now. This was materia medica. So I have two. One is the Borike and one is the Kent. The Borike materia medica and the Kent repertory. And I also have Kent's materia medica. I like to leaf through it at night. Sometimes I'll go to bed, everything is turned off, computers are turned off, and I like to read sometimes. And then other times I will look it up online. And I got this for $12 at a used bookstore. So they're cheap. Nobody wants to know about homeopathy, so you'll get good stuff cheap. Another good source of used books is abebooks.com, but they may be a little bit more. So look up the used bookstores in your area, see if you can find materia medicas.
Great, thank you.
Okay, so that's the materia medica, that's repertory, and those are the sort of the books you will use to learn homeopathic remedies, to learn what is applicable to your life. And I wanted to show you this just to see how things are done in real time by real people. And so this is a holistic vet who uses mainly homeopathy to treat animals, dogs and cats, 90% of the time. And this is her dog that she got when he was a little older from the rescue, he was going to be euthanized or something. And her name is Destiny. This is Destiny, and that is Destiny's flaring cancer. And she had a cancer when she was very young, and this vet treated it with homeopathy and made the cancer disappear. And then what happened was Hurricane Sandy hit. They had 12 feet of water in her house, and she got very, very sick. Within 3 weeks, the tumor had tripled in size to a 3.5-inch tumor, and she was fast dying. That is from November 7, 2012, she started treating her, to December 1, 2012. She used all these remedies: carcinosin, carbovegetablus, lachesis, carbonium sulfuratum, and then pulsatilla to cure her cancer. And if you don't believe it, here it is. Everyone see this okay?
Yes.
So this is her dog, her beloved Border Collie mix. She had one of the most aggressive mast cell tumors that this doctor had ever seen in her 30 years. Hurricane Sandy hit, and the tumor grew and grew. To my despair, a week into my 12-day power loss, she had a electricity loss. Destiny's tumor ballooned from its flat white non-active state to a 3.5-inch angry looking red mass. Looked like a double tumor, one piled on top of the other. And it had metastasized into her lymph nodes. The dog was dying. So she's very distraught. She gives carcinosin 30C. It was very, very angry looking still. And this is how the tumor grew. It grew and grew and grew in a very short time. And what she said was the tumor was solidifying into a hard mass. It was very foul smelling. It was necrotizing an ulcerative tissue. Serum was oozing from its surface. And I have to admit that I cheated. I saw this case and it resembled our Roxy so much, I gave her carbo-veg, and guess what's happening to her tumor? It is falling apart. So now the tumor is progressing, solidifying into a hard mass. And this is her thought process when she repertorizes a symptom, which is why I wanted you to see it. Now, serum's coming out of this tumor, and there's a deep cord running through this tumor, and the inguinal lymph node in the here down under is very swollen. She stays by herself, so the dog does not want to deal with any human being. She is sitting in a quiet corner by herself, licking that tumor. She gave her carbo-veg. It is a remedy used for skin conditions, including tumors, where the tissue is ulcerative, moist, foul, decaying with fetid discharges. And that is our Roxy's tumor. It is on her gum, and I thought her smells were coming from inside her gut, because that's how it's always been with smells. But I totally lost the idea that it could be from the tumor, because her digestive system is actually pretty damn good. And you can tell from her bowel movements and all that. No blood, no nothing, perfectly formed poop. So the stink is coming from the tumor. It's ulcerative. And I gave her carbo-veg 30C, I think last week sometime. And lo and behold, the bottom part of her tumor fell off. It bled. It was a vascular mass. It bled. I thought, shoot, she ate something hard. But nope, it's like a cauliflower-shaped tumor, kind of like this, and the bottom part fell away. So this is how you learn. This is how you learn. Because I was trying everything, the materia medica, the repertory, and I had some symptoms, and it was stable, but it was not coming down. So anyhow, this is Destiny's story. The tumor, you see the ulceration has declined a little bit. It's not as smelly. It's a little bit clean around the outer margins. And it's kind of drying out. It's shrinking. On November 12th, the tumor continued to shrink. And do you see the difference between this tumor, which is bright pink and red and fresh and growing, and this tumor, which is kind of reddish purplish? It's less angry looking. And so this is lachesis. Lachesis is skin that is purplish red. That is the highlight. That's the keynote of a remedy called lachesis. And that is what she gave to her. Lachesis, after repeated doses of carbo-veg tablets, she gave her lachesis. And see that double tumor, there's a tumor here and there's a tumor on top of the tumor. There's actually a very specific remedy for that, and we'll talk about that. So anyhow, she gave her carbo-veg first, then she gave her lachesis on that note purple. It was purple. And the tumor shrank further. And then she gave a remedy called carbon sulfuratum, carbonium sulfuratum, because there were these double tumors, and that's a very prominent keynote of this remedy. You get double tumors, and that's what I've ordered for our Roxy, because she's got double tumor, one behind the other, and hopefully that'll work. So she was given lachesis, repeated the lachesis. Look at the size of the tumor. Less purple, becoming much flatter, much smaller, much smaller. The tumor looks like it being chewed off. See that? It's looking like it's been chewed off. It's actually just disappearing on its own. November 18th, it's regressing some more. She's licking it and she's finally started eating. When your dog starts eating, it's a very good sign. Clear yellow serous material is oozing from the marbleized looking mass. The lymph node again is large. She's eating only selected foods and so on and so forth. And she gave her carbonium sulfuratum, which is 2 doses, 2 hours apart. This remedy is useful in controlling the growth of cancers. And a keynote is double tumor. So when you see in your repertory double tumor, or if you look at the materia medica, you're going to see all these signs and symptoms, but you might think it's like looking for a needle in a haystack. But read about it on the internet. Just Google whatever condition you have and say homeopathy for that. And there's a lot of generous and helpful suggestions. So maybe start from there. In other words, I'm saying do something. Something is better than nothing, and you'll hit the right remedy eventually. And then the most important thing, the tumor begins to shrink. I canceled my Christmas holiday in India because I knew in my heart that if I leave her, she would die. As she would have. Tumor shrunk some more, almost gone, almost gone, almost gone. December 12th, she starts her on pulsatilla because why did that dog get pulsatilla? Why did my friend in the hospital sound like she was dying? She was panicked. She was overtaken with fear. She was stressed out. And this dog will die if she gets into a Hurricane Sandy type situation again. And she'll most certainly die if her master goes away. So she started her on pulsatilla, 10 drops once a day, which is she's going to get forever probably. And December 9th, the tumor is completely gone. This is a giant, giant tumor. So that is the story of destiny. Any questions? No questions.
I actually have a
Yes.
question. Is
Oh,
how does one tune into what's needed at what time? How does that progress? How do you know that?
Yes. The way one does it is by the symptoms. The symptoms have to match the remedy. So early on, it was a cancer. She knew it was a mast cell tumor, 1 dose of carcinosin. That sort of cleared the state. And then a couple days later, 3 days later, so yes, that's a very good question. You look at the timeline here. 3 days later, she gave carbo-veg because of the nature of the tumor. She didn't go around looking at the description, oh, it's an osteosarcoma or a mast cell or a lymphoma. You look at the symptoms in plain English language, which is why I say it's people's medicine. You don't need Latin names of diseases to know how to deal with your own. And so it was fetid, it was on the skin, it was ulcerative, it was stinky, carbo-veg. And she was very prostrated, and that's a classic hallmark. Wasn't eating, wasn't drinking, carbo-veg. That's a carbo-veg state. Then after the tumor sort of stopped ulcerating, started drying out, became less fetid, then the symptoms changed. Now that tumor has shrunk and it's turned black and blue. That is a keynote of leukemia. Leukemia, the blood is dark, thick, viscous fluid, and she was in a leukemia state. So she gave her 14th and 15th, she gave, and these are minor doses. You don't want to give a very ill dog large doses, potentized doses, because they could be aggravated and die. So tiny, tiny doses. And then it was because it was a dual tumor, and this is a cancer remedy, she gave this. And you don't have to be a genius. Copy someone else. Copy someone else's protocol and see what happens. But use your own brain too, in that you're copying someone else, but it has to somewhat match what's happening to your body or your dog's body or your cat's body. There was one more question from someone else.
it was for me. Would carbo-veg apply for me or for humans, and as well, or is a specific tumor it applies to? Tumors are tumors,
yes.
or what?
Yeah. It
Yeah.
applies to a specific tumor on the skin, on tumors on epithelial surfaces. So outer epithelial surfaces in particular that are ulcerating and necrotizing. And the person is very prostrated. They can't get up. They will not get up and move. They're not hungry. They're like wilted, like a wilted plant. That's carbo-veg with all the tumor necrosis symptoms.
So I have a brief question about, it's kind of beginner's mind, if you will. I've taken carbo-veg 30C for other conditions. So I'm taking the same thing for a different condition.
Yes.
So I'm wanting to know a little bit about all of that, because as far as I know, I do not have cancer.
Yes. So the other condition is hypoxia, when you don't have enough oxygen in your body. What happens? Your lips turn blue, your nails turn blue, you can't breathe, you're short of breath, and you just want to sort of lie down. If you have a mask on your face, carbo-veg is beautiful because it helps you deal with the hypoxia.
Which is exactly how I've used it in those conditions, and
Yes.
it's very successfully used.
Yes. And so with COVID masks on, there's nothing as wonderful as carbo-veg tablets. Carbo-veg tablets is good for digestive problems because that's the inner epithelium. When you have flatulence, when you can't digest food properly, when you have grumbling and rumbling and pain in your stomach, it's great.
I'd like to say one thing about, sorry.
Yeah? Norel, say it.
Oh, sorry. I don't know if you're all aware or experienced this, but there seems to be a lack of oxygen since the last fires. Have any of you felt a little, I'm not getting enough oxygen? Apparently it's true. With the chemtrails, etc., they're depleting our atmosphere and the beautiful plants with oxygen. So would that apply to take anyway for the hypoxia?
Yes, absolutely. That's a very excellent point. Keep it in your back pocket. You go out for a hike, the sky is overcast with smoke, you feel out of breath, carbo-veg will do the trick. If you accidentally, turn on your car exhaust in the garage and, got carbon monoxide poisoning, carbo-veg is your ticket. People come back to life like that. It's amazing, an amazing remedy, low potency.
Extending a little bit on that has to do with practices I've learned in the past about breathing, not for anything forced, but something that feels pretty natural. For instance, if I'm running a lot, or if I'm doing some activity, I'm breathing deeper. If I'm doing a meditative process or something, I'm breathing much more slowly and much more deeply. So I'm wanting to know if that somehow relates to, not directly to chemtrails and everything else, but the amount of oxygen and how we use it.
Yes. Buteyko breathing is the single best thing you could do, which is actually breathe into a paper bag. So you're breathing in more carbon dioxide so that your red blood cells release oxygen. Yes, breathing is very important in dealing with this. You might be frightened. If you're frightened, breathe into a paper bag. If you're hyperventilating, you're taking in too much oxygen and not enough oxygen is getting removed from you don't have enough carbon dioxide in your bloodstream, which causes the oxygen molecules to be released to your tissue. So breathing is super, super important in having good oxygen supply to your tissues.
Great, thank you.
I have a quick question.
Sure.
So it's interesting to see Destiny's story and how the remedies change. So I guess as her symptoms changed, and then you change the remedy to the symptom. So that's really different than like a constitutional where you just have one remedy across the board.
Yes, exactly.
Okay.
Absolutely. Yes. And it's possible your constitutional might work for the acutes, but it might not. And at the end of the day, you got to do stuff that makes you well again. And so if something is not working, that's a very important point. If something is not working, don't go by theory, go by what actually happens.
Mm.
And a good homeopath will quickly see the constitutional is not working. especially in an acute. In an acute, that acute disease or illness takes over your constitution. Like if you have cancer, you got a sudden shock, or you're exposed to toxins, you got cancer, that miasm may override your constitution.
Mm.
By the same token, your original, what you inherited from your parents or past or your fetal life, may cast a pall on everything that happens to you. And even for your flu, your constitutional might work better. But it depends. It would depend.
Okay, thank you.
And you're going to have homeopaths that take these positions, okay? There's some who are going to say, oh, small doses only, oh, large doses only constitution. They're all right. They are all right. But at the same time, it's like the way to heaven. There are, 100 different paths to heaven. There's 100 different ways to skin a cat or get to a solution to a problem. That having been said, you raised a very important point, which is there are people who flit from remedy to remedy. I would not do that. I would not use mixed remedies. I would not flit from remedy to remedy. The purpose of this call, guys, of this Zoom session is to give you confidence in your ability to read this. This is experience of 300 plus years now almost of looking at people, the effects of different remedies on people. This works. And you have to trust that if you took antimonium crudum for your sentimentality or weepiness in moonlight, then it'll work. And either it'll work or it'll not work. If it works, then you know you were right. If it doesn't work, you move on to the next thing.
So I just heard you, Shama, this is Dasha. I just heard you say that, don't jump from remedy to remedy, and also kind of don't throw everything in.
Mm-hmm.
So does that mean that you also don't mix different remedies? Do you kind of pick one, stick with it for a few days and see if it works?
Mm-hmm.
Because also with your friend in the hospital, you did several remedies at the same time.
Yes, my hands were tied. She only had 2 bottles. It was the best I could do, and it worked.
So there is no rule of don't mix remedies. In homeopathy, you can mix them?
You can mix them, but be aware that the more remedies, it's like giving a vaccine. So vaccines are like the evil twin of homeopathy, right? So vaccines frequently will be for 5 different types of the flu or pneumonia or this or that, or doctors will often give you a pneumonia, shingles, and chickenpox vaccines all at the same time. You don't want to do that. You don't want to have a supermarket of remedies. But at the same time, if you don't have a choice, or if all of the supermarket remedies are indicated, then you do it. And for some homeopaths, they've had great success with just giving these, like Traumil. Traumil is a polypharmacy. It's a bunch of different remedies in very low potencies, and it seems to work for people. And if it works for you, do it. But learn to discriminate between remedy, and you'll find that initially you might use Traumil, and then 2 months down the road, when you've learned a little bit more and you get bruising pains, you will only use arnica, one component of Traumil. Or if your nail gets torn off and you have nerve pain, you'll only use hypericum, because that is the remedy for that.
And like if there's a torn nail and there's a nervous pain, there is no length of time that you commit to with any remedy, correct? You just go day by day watching symptoms, and it could be 1 day or it could be a month.
Correct. Absolutely the opposite of allopathy. You don't need to take a 10-day pulsatilla course unless it's indicated. If it's indicated, yes. The second that your person or the dog or the animal starts to feel better, you taper off.
I'm assuming it's not the same with preventative.
I would not do preventive medicine unless the disease was in my ranks. I was living in a family of 10 people and 5 of them came down with COVID, then I would take a prophylaxis. But I wouldn't take it if I was living out in the sticks where there's no chance of disease unless I got the disease. So you have to use your judgment.
Okay, thank you.
And if you're terrified, by all means take it. It's not going to kill you. It's not like taking antibiotics or chemotherapy or radiation. Those will kill you. The homeopathic remedy might aggravate, but it will not kill you. And if you do take prophylaxis, it's okay because you're not taking huge amounts. You're taking one every few days or, you know, at intervals. So use your judgment. And this is a answer, you might think this is not a rigorous answer, it's a wishy-washy answer, but a lot of answers are true, and whatever heals you is the ultimate truth. Yeah? Any other questions? Alrighty, so we talked about materia medica, we talked about repertory. These are two ways that you can gauge what medicine is good for you. And by the way, this is not homeopathy, this is life, you know. First, you have to figure out what is wrong with you. Then you have to figure out if the thing that you're picking to fix that wrong thing is actually going to work by looking at that remedy in greater detail, right? And then you do it. And it's going to work or it's not going to work. If it works, great. If it doesn't, you move on. So this is a very good cheat sheet that'll be very useful to you if you call me and say, Sushma, I have a sore throat. I really won't know much about your sore throat. If you were to say, I have a sore throat, it's on the right side of my throat, my tonsils are greatly swollen, I was up coughing after midnight, and by the way, someone just died in my family. I have a whole bunch of clues to work with. And the clams are the clues. They're the very clues you need to train your mind to think through. So if you ever get sick, this is very good discipline because it also makes you feel good. When I was sick in Paris, I was very sick for me. I wrote things down in a spreadsheet every single day. What was going on, how I felt, what remedies I was taking, what food I was taking, and what my concomitants were. And chief complaint was. And what that does is it helps you trace the trajectory of your illness. It's a good thing to tell your doctor. If you go to a Kaiser doctor and you say, oh, I have a right-sided headache and it's throbbing and bursting, they'll say, get out of there, just take this ibuprofen and go. So for allopathic medicine, this is not as critical as it is for you, your spirit, your soul, your body, and also for homeopathy. Because allopathy does not believe your spirit, your soul, and your body are connected, but homeopathy does. And what homeopathy says is whatever is happening is not happening in your head or in your throat. It's happening to you, Marlene, or it's happening to you, Lata. It's not happening in your throat. And so what we're doing is treating you like a person, which is really cool, because if the nurses had just forgone, kept from asking her questions for an hour, held her hand, I know, no one, it's not science and all that, her blood pressure would have normalized, her hands would have gotten, her extremities would have had blood flowing to them. Just simple things can make a huge difference. And we know that about our bodies because they're connected to our souls and our minds. And you cannot cleave that connection without risking your life. You can't. There are people who have never been well since that accident. There are people who have never been well since someone passed or their dog passed or some traumatic thing happened to them or whatever. Or since they got that particular flu or they took that particular drug, antibiotic. And those are things that are very important. All right. Any questions? No questions. Okay. C is for concomitant, which is things that, and chief complaint. The chief complaint is I have a sore throat. Concomitant means the side stuff that's considered irrelevant in other forms of medicine, but is considered very relevant in homeopathy. And the concomitant could be, my throat is hurting, and oh, by the way, my toe, my left toe is swollen. The toe has nothing to do with the sore throat, but they're happening together. And that's super, super important. And it's not even really bothering you, but you just say it. That's a concomitant. Location, you got to tell the exact location, right or left, top or bottom, right eye, left eye, the right side of your lungs, the left side of your lungs are full. You feel a pain in above your belly button, below your belly button, in your heart, in your back. Very, very important. That's L for location. A is for etiology. You are the person who are closest to yourself. And I'm not you. The doctor is not you. Your friend is not you. Only you know or have a better idea than any one of us the etiology of your disease, your illness, your condition. And it behooves you to ask yourself. It behooves your homeopath to ask you. It behooves you to write it down. I feel this happened because I got cold that day and I gardened too much. And since then, man, my joints hurt. That's etiology. A death, a car accident, arguments. I fought with my spouse. And since that day, I've had this headache that won't go away. The fourth thing is modality. What makes it better or worse? And that's a harder one because in particular, I'll find, and it's harder with children. It's harder with people who are unconscious. So you've got to use your mind and look for yourself. Like my friend's modality in the hospital was that holding her hands, not rubbing, but holding and pressing made it better. She was more bryonia than she was pulsatilla. She didn't want to be alone. And certain things made her better. Laying down made her better. Sitting up made her faint. So these are modalities. They're called modalities. Other things that make you better or worse. If I tie my head up, then the headache lessens. That's a modality, tying up. If I go in the sun, it worsens. That's a modality. Super, super important in getting clues. The 1, 2, 3, 4, 5th thing is sensation, and that's probably the most important, but none of us are there yet, and we will get there as we know our remedies and as we know our loved one or our friend or our client. I have someone I work with who has children that I didn't know about last year, and over a period of time, I get to know their personalities. And I know what sort of kids they are, or one of them gets panicked in the dark, one of them gets angry under certain circumstances. And so that eliminates certain remedies and makes use of certain other remedies. The other sensation is physical sensation or mental sensation. It's throbbing, it's burning. The more you can describe it to yourself or to others, the better. You know, my throat only hurts when I'm swallowing. That's a sensation. I feel like there's sticks in my throat. I feel like there's sticks in my anus, in my rectum for hemorrhoids. That's how much it hurts. It hurts at the bottom part of my pubis symphysis. When I have periods, only my tailbone hurts. And it hurts in a very throbbing way, or it's a dull ache, or I feel like the knives are stabbing into my head. Super important. So that's sensation. Any questions on this?
I have a question. So in the very first example you mentioned in concomitant of I have a headache and my right toe is swollen. Mm-hmm. So would you look for a remedy for both of those symptoms, or
yes,
you do?
Yes.
Oh, okay. That was my question. Thank you.
I should have put a picture of a funnel here. Think of it as a funnel. You have a sore throat, and there are 200, remedies for sore throat. But you also have a concomitant, a sore throat with a toe hurting. There are remedies that have both. So that narrows you down to 20 remedies. Then you say the location is only the right side of my throat. So there are remedies that have sore throat and a toe hurting, and that are only sore throats on the right-hand side. Then you say this happened after a certain event, or I was in the cold, and there are remedies that are pertinent to those etiologies. Narrows further. So that's sort of the mental symptoms. And then the modality and the sensation will narrow. The point is to take a bunch of remedies and narrow down. You can do it by hand. You can do it in a spreadsheet. You can do a repertory program. It's much simpler with a repertory online. So I will show you what the OO-Rep is, which is a free online repertory, and I would encourage you to use it. Anything else? Any other questions? All righty. And I know it's a lot to digest, but it's simple. It's really simple when you get down to it. Literally, for your life, you need 5 or 10 good remedies that you can rotate through that work for you. It's not complicated, guys. So that this is the point of this slide, is to show you what remedies work for what part of your lungs, because we've got COVID going. COVID pneumonias are practically non-existent if you're treating it homeopathically. And so what they found in the Spanish flu, all the flu epidemics, was that homeopathic mortality rates in the homeopathic hospitals were 1 to 3%, whereas in the regular hospitals, they were 50% or more. And the reason for that is when a person is ill and you suppress that illness with antibiotics or painkillers and so on, it progresses to pneumonias. So if you don't want to go to a hospital, land up with pneumonia and get more drugs, you want to use homeopathy in the early going to abort a bad future. And lung remedies are a good example and a relevant example in today's time. So if you feel you have a pain in your right chest with your cough, lower lobe, lower-ish, that's a bryonia in the early stage. In an advanced stage, it could be lycopodium or kali carb when your lobe is filled up, or chelidonium, which is a liver remedy that also pertains to the right side, that also pertains to the lower right lobe, or Merxol when the liver is, when there's hepatization, which is your lungs are sort of falling apart and dying. Merxol is a great remedy. Likewise, for your left upper lobe, there's these remedies. When your infection is still at your throat and traveling through your lymph nodes into your chest cavity, these are the remedies to use. And so it's nice to have a little map, which is in the early going, you can use arsenicum, you could use calcarb, you could use Merxol, sulfur, tuberculinum, theridion, etc. As the disease progresses down, as it goes deeper and deeper, especially your left lower lobe, which is where I had my lung problems. The FOSS was very helpful for me. Oh, where did the arrow disappear? There's the arrow. The FOSS 1M was very good for me, based on my other concomitants, modalities, etiology, etc. Any questions?
I have a question. And before I became aware even remotely about homeopathy, I would have symptoms and I would learn to relax or do something else, and then they would disappear, go away, whatever I would call that. Recently, I'm finding some of the same conditions that I'm aware of something that's happening. I'm not using a homeopathic remedy for it. I do something else, I relax, I do some other activity, and then I notice that that symptom or that whatever that is goes away.
Mhm.
So I want to make sure that I know how to properly use homeopathy. At the same time, are there other things that my body is doing by itself that don't need, quote in quotes, homeopathy?
Yes. Homeopathy assumes that your body is like a fine-tuned violin. It knows exactly when it's tired. It knows exactly when you're feeling under the weather or pain is happening. And you got to trust those symptoms, because they will lead you to the right remedy. And if you don't want to use any pathy, whether it's homeopathy or allopathy or acupuncture or anything, if you can sort it out with diet, with exercise, with rest. It's only when the basic things fail, or if your cough keeps coming back every month, gets better, comes back, gets better, comes back, then you consider homeopathy, and you base it purely on your symptoms. If it ain't broke, don't treat it.
Excellent advice. Thank you.
Any other questions? All righty. This is something that happened to me. I love eating my wheat. I know a lot of people are sensitive to wheat these days. They can't eat it. I grew up eating fresh, ground, whole wheat chapatis. They agree with my stomach. I get really good bowel movements. Mentally, I'm better, but it has to be very high quality wheat, and it's hard to find. And so for a while there, when my never been well since point was returning from the forest fires. I keep harping about that. That's true. Until then, I was very healthy. Came back and I had these, I would find that when I ate chapatis, I would get these flaming sort of areas in my joints. And I reduced my wheat eating. And then I said, no, I want to eat them. And there is actually a rubric in the repertory. If you look at this: extremities, arthritic nodosities, in skin over joints, and the remedies lead them. There are excrescences that grow over your small joints, and there's a wonderful Banerjee protocol for them. That's a combination of ledum and belladonna. And as I started taking it, that inflammation went away and I could eat my wheat and all was good, and it's still good. So the repertory, this picture, this book here is, folks, is made up of your common symptoms that happen to the vast majority of us. And if you put in the right words into the repertory, you know what will help? If I actually bring up the repertory. And here I am bringing it up. Do you see this page? Can you confirm? Everyone see this?
Yeah.
Okay, this is called oorep.com, and I type in extremities.
I can't see it.
Oh,
We're still saying the document that you shared, not
Page
the
one.
page that you're looking at.
oh, okay, got it. Okay, so I have to stop sharing this. Wait, and I have to stop sharing, share this. Do you see it now?
Yes.
Okay, so what we're doing is I'm typing in the word extremities. What was the other? In Old English, they say arthritic nodosities, and I wouldn't know that. So I'm just gonna say skin, because I had this nodosity here under the skin and on top of my joint. Can you see my hand here? Everybody see my hand?
Yes.
Okay, oh, sorry, here's where my nodosity was. So I knew it was skin, and I said joint. Let's see what shows up. Look at this, woohoo! Extremities, arthritic nodosities, and skin over joints, lead them. That's where the Banerjee protocol comes from. Ledum and belladonna. So this, folks, is a great repertory to use. It's free. It's got Publicum, which is a combination of Kent and a couple others. It's got Boger Boninghausen. It's got modalities. It's got guiding symptoms, a bunch of things that are very interesting. Use it. And, you know, give me a symptom. Let me look it up. So, Carol, tell me pain in leg, right? Someone unmute yourself and tell me a bunch of symptoms and I'll see what we can find.
Arthritis in my hands, my fingers.
Okay, extremities, arthritis.
Can't believe I'm having that.
Finger. No overturned. So we're gonna change this. We're gonna change this to extremities, arthritic. It could be there. Now we're gonna get a bunch of some remedies. Extremities, arthritic nodosities, finger joints. Extremities, arthritic nodosities, finger joints with stiffness. Which one do you have? Do you have finger joints with stiffness, or
they're starting to become disfigured and they're painful.
okay, with stiffness and pain? So you could do pain. So these are nodosities with finger joints, and this is your set of remedies to choose from, right? And so what I'm doing here, look here on the right side, I just said add. Do you see that at the bottom? It got added to the top, to the bottom.
That's
So
what my mother had. Sorry for interrupting. And she had osteoarthritis.
Oh, so you're not going to find words like osteoarthritis, but
Yeah.
English language. So this is kind of sort of that, or bone loss or necrotizing. You can use a bunch of words, which is why having a book is good, because you can go through extremities, arthritis, and the words that they're using, and then type those words in. Okay, so
Sushma, may I ask a question? I didn't know, my family don't have it, and I used to build gardens, and I used my hands a lot, but you can tell the earth hands, but I used to punch the water with a paddle 11 months a year, like 5-6 days a week training. Did that contribute to that?
yes, you got trauma. What'll work for you is Bellis perennis. Old trauma is Bellis perennis.
Yeah.
You take a large, of course, very slow, continuous doses of Bellis will help with that. Trauma is very different than arthritis, although it could cause arthritic joints as well. So now we have a pain. We have a pain repertory here. And so we're saying pain, boring, aching. Just say first joints of fingers. You only have it in the first joints of your fingers, or you have the first and last joints, or you have it only in your metacarpals. It helps folks to know what a metacarpal and a metatarsal is. It helps to know some of the names. First joints of fingers. So we don't know which joint Norel was talking about.
It's my fingers, joints, and it's also my right hip, because I used to be a runner.
Gotcha. So fingers, first joints, or all joints?
Most joints right now.
Okay, joints off. Okay, so we're gonna add this. And then you say hip pain?
Yeah, right hip pain, yeah.
Hip.
And I'm sure it's from running, yeah.
Okay, pain, hip, right. Let's see what shows
I'm
up.
cracking up.
Here we go, right hip from sacral region. Burning pain, hip pain. Extremities, pain, hip, right. So we're gonna take the rubric with the largest number of remedy. So guys, this is not rocket science. This is just using a computer. What is a little bit of art is taking this repertoire. So now we've got these 3 symptoms that Norel has. One is extremities, arthritic, nodosities, finger joints. There's all these remedies. So your joints are arthritic and swollen. There's stuff, concretions there. Then extremities, pain, aching fingers. So I assumed aching, you can do bursting or spasmodic or whatever you like. And then you have pain in the hip. And we repertorize it. This button you hit here is called repertorizing button. Ledum is the remedy. How about that? Norel, Ledum 200 and belladonna 3C mixed together is your remedy. And why is that the remedy? Because it's got 7 points. It's very good for finger joints nodosities. It's very good for hip pain, and it has aching pain in your fingers.
If
So
I may say, I went to Marine General before I met you, and they've recommended I do this. I forget the name of it, by design, I'm sure. It's awful poison. They inject in you, and it's meant to be for bone loss. And they were late. So I said, look, could I just see the disclaimer list? It was like War and Peace. I just asked for a pair of scissors. I cut off my tag and I left. But it actually causes hip bone loss, what they're recommending for people. And I really can't think of the name right now. A lot of women are on it.
It's a fluoride. It's a fluoride laden. What is the name for it? Fluoro something, or the osteofluoro, fluoro ost or something. And it actually prevents the activity of the osteoclasts and osteoblasts. It prevents the osteoclasts from working, which is your bone is constantly being made and being broken, made and broken. And this interferes with the process. So your bone cells don't break, but they can crack. So you actually get more fractures. And when the fractures happen, the fracture happens first, and then you fall down because your bone just cracked. And then you fall down and have the diseases of, or the illness of concussion and, you know, coma and unconsciousness and all that. A much better option is Leadum 200, Belladonna 3C. Give it a shot twice a day, every day until much better.
Thank you.
And that's by far more points than the next second best, which is lithium carbonicum. So what I would do then, folks, is you have Leadum, you have lithium carbonicum, you have calcarea carbonicum, you have benzoic acid, you have apis, and, you know, 3 all the way to here. Just for academic interest, read the materia medica on these and see, is that you or is that not you? And if you don't think you know yourself, ask your husband to read it or a friend to read it to you and say, am I a Leadum? Will this fit? And you'll find that you're spot on in time. Questions? Pretty cool, eh?
I have a question about those remedies. So you're offering now the kits
Yes.
with 50 half dram. Half dram. I don't quite know how many pellets in the half dram remedy, because I know the one that Boron sells that tells you like 80 pellets or 200 pellets. How many pellets are in your remedies?
You know, I don't know. That's a good question. I'll find out. I'll find out and let you know.
Okay, thank you.
The point is, all you need is 1 pill in a water dose to make this go away. Those, even a half dram will last a lifetime. You don't need much. Even if it had only 80 pellets, which a lot of them, the bigger sized ones do, it would last you a lifetime.
Oh, the recommendations on Boron, their little packaging always says dissolve 4 under tongue or dissolve 6. And you're saying 1 in water?
Yep. It's even 1 will work. It's a highly potentized, diluted succussed remedy. And so literally 1 poppy side, so long as it stays under your tongue or in your mouth on a mucosal surface for 30 seconds. So it's a water dose, hold it in your mouth for 30 seconds. If it's a pill, hold it under your tongue for 30 seconds. You're good to go. 1 pill. That's all you need.
All remedies? All you need is 1?
All remedies.
Wow. They've been lying? Selling 6?
They're not lying. What they're saying is, just for good measure, take 5 or 6 or 2 or 3. It's a random number.
Huh.
1 is as good as 20. A dose is determined not by the number of pills you take, but the frequency. And that's the other different thing. In allopathy, our head is used to allopathic, 100 grams of gentamicin is this, and 1,000 milligrams is a lot more. It's not the case in homeopathy. 1 dose and number of pills.
So with the dose in this remedy, for example, would you say 1 a day, 4 times a day? How would you describe the frequency?
Yeah, so the frequency is what is important. So if I was Norel and if it was hurting 24/7 constantly, in the early going, I would take it 3 or 4 times a day. If it is excruciating pain, by all means, take it more frequently. And as it gets better and better, taper it down, keep the water dose in your refrigerator, starts up again, take it. Over time, it'll disappear. And that's the key. Over time, your condition will disappear or get vastly better. Unlike arthritis medicines, which are really palliative, standard allopathic medicines, or not just not palliative, but they will actually kill you.
Okay.
Osteoarthritis drug, osteoporosis drug, excuse me.
If I may say something, the short time I was on chemo, and when I passed out, whatever, concussion or that, I fractured my sternum. How do I get that back again? Is that through doing the same process, the same protocol?
That was through injury.
Okay.
Okay.
But why the sternum? It's the hardest bone in your body, isn't it? I mean,
it's the hardest bone and you cracked it. You had a pretty bad fall. You should have taken arnica right away and that would have healed it. Actually, symphytum and ruta would have been a very good. Symphytum, ruta, and arnica. But try that, symphytum, ruta, and arnica. You're already taking ruta, so take symphytum and arnica. And if that doesn't work, try symphytum and bellis perennis. Bellis perennis for old injuries is for old injuries.
how do you pronounce that again, please?
Bellis, Bellis, Perennis.
Thank you.
And so, so different etiology, right? Your arthritic nodosities are caused by factors of diet, lifestyle, constantly overusing that finger or eating wheat in my case. And the break or the sternum injury is from a fall. And so you want to look at arnica bellis perennis for that. However, if it has healed over and there's a nodosity, then the nodosity remedies will help. But you got to know some of the words, which is just remember how to do this search. This here search means ARTH, wildcard means arthritis, arthritic, or all the other verbs related to arthritis or arthralgia. So if I type in ARTH, I will get so many words: arthritic, arthralgia, mainly it's arthritis, but it could be arthritic. See, if I didn't put in the wild card there, I wouldn't get. If I just put in arthritic, I would not get arthritis. So you have to learn to use the wild cards wisely. Any questions on the repertory?
Thank you.
All right. Okay, so I'm going to stop sharing this and I'm going to start to reshare this. There. Everyone see this okay?
Yes.
Okay. So this is what I took. I took ledum and belladonna, and I can eat all the wheat I want, no problem. And I don't know, it's healed a whole bunch of stuff in my body. Maybe there's something else. But the point is, I'm judging it by symptoms. So I'm not, while I'm looking at the etiology and while I might think it's because every time I eat wheat, there's two ways I could go about this. I could fix my gut, I could fix my joint, but the ledum and the belladonna combination is addressing my gut and my joints. And so that's a good thing. And if it goes away, that's a very, very good thing. So that's that. Then people have back pain. Like Richard will say, my back hurts. Richard, where does the back hurt? Is it upper back? Is it lower back? So it helps for you, because this is where they do use these words. It helps you to know what is a coccygeal. Coccyx is the very last end of your tailbone. If you fall on your butt, you hurt your coccyx, and there's remedies in there for that. If you've just had a baby, your sacral vertebrae might hurt. Richard hurt his vertebrae over here, this one over here while he was gardening. So I would look at remedies for the thoracic vertebrae and the lumbar vertebrae, lower middle back. So it's called the cervical vertebrae. These are the thoracic, these are the lumbar, these are the sacral. And so you got to ask, or you got to tell your homeopath where exactly it's hurting. It really helps if you think in those objective terms. I have a pain in my lumbar vertebrae. It's from an injury. And oh, now I have a frontal headache always, ever since the injury, and it hurts in my temples. So then you repertorize those things and there's a remedy that's going to pop up. Sometimes you can't use the same remedy for everything. And like you have several different things going on. And to Karen's point, should I use the constitutional or peel away layers? You play it by ear. If your constitutional does not work, your back remedy does not fix your headache. So those are two separate remedies. So it's just common sense. I think it's just common sense. And don't you let anyone scare you into thinking you can't do it, because you can. It's people's medicine, folks. So you go from the top to the bottom. So anytime any one of you may have worked with me, you will note that I ask random and dumb questions like, how do you feel? And, you know, when was the last time you had your vaccinations? And how are your bowel movements? All important. And in taking and giving cases, you want to have in your mind an organized thing, an organized file of, my mind feels like this, I feel depressed, I feel emotional, I can't talk, or I'm talking too much, or I feel anxiety in front of strangers, to my head, it hurts once a week, to modalities, it only hurts during daytime or nighttime or certain times of the year, or spring or summer or fall, along with a history, and exciting or maintaining causes, meaning every time I do this, that happens. And then finally, there's this thing called miasms. Anyone know what a miasm is, or take a guess? Come on, take a guess. Unmute yourselves and think about what a miasm might be. At least one of you knows what it is, I think. Miasm is what you bring to the table from your prior history, from your prior life, from your parents, grandparents, and so on. You know how they say this runs in my family, or tuberculosis, or asthma, or cancer. That's a miasm. Or everybody in my family gets eczema when they're XYZ years old. That's a miasm. And what Hahnemann saw was that at some points, he would try all the acutes and the constitutional, and it wouldn't work. And then he said, this is something that's coming from their intergenerational miasms or intergenerational problems, and you got to get rid of that before you can move to the next thing. And lo and behold, it worked. If you had a cancer miasm, you would give carcinosin. If you had a tuberculosis miasm, you would get tuberculinum, and so on. Or syphilis or psoriatic miasm, you had skin issues, you would give sulfur or something. And then the next remedies would take effect. That's a miasm. Any questions?
I'm not clear on how miasm's remedy is different from, you know, your regular arthritis, like arthritis runs in my family versus I have arthritis today.
So you start with arthritis today, and it should work, because the remedy for arthritis would generally be also the remedy you would use for the miasms. Like if I have cancer today, you would take carcinosin today. And if your mom and dad and grandparents and great-grandparents died of cancer, that's a miasmic as well as possibly a constitutional and possibly a current acute remedy as well. But if you have arthritis and you had a cancer miasm and your arthritis remedy is not working, then perhaps the miasmatic remedy will work first, and then you give the arthritis remedy and that'll work.
Do you ask for familiar, you know, lineage symptoms or diagnosis in the first consultation, or is it down the road if what you've been prescribing isn't working?
That's a good question. When I meet with people, I ask them about every single nit that happened in their lives and their bodies. And that takes time. It's like an hour, hour and a half. But you don't have to do that. You know yourself. Start with the arthritis remedy. And if that doesn't work, think back and go, aha, I had tuberculosis for 4 generations. Maybe my miasmatic interference is preventing this remedy from working. But always start simple, slow, immediately preceding that event, and then go backwards.
So since you don't actually have symptoms of tuberculosis because you've had it, you know, in your lineage, but you don't have it in your body currently, how long would you be taking the remedy for?
You would take it for the length. That's where the art comes in. You would look at the literature, you would look at yourself, you would see what level of miasm you have, and start with a low dose, you know, like a 6C, tuberculinum 6C, or carcinosin 6C, or 30C, or 200C, and take 1 dose and then take your next remedy and see what happens. But by and large, you shouldn't have to if the presenting symptoms remedy works.
Okay. So a lot of it is experimenting and just watching yourself very closely.
Yes, yes,
Okay.
yes. And you just made a very, very important point, which is watching yourself closely. What this is going to do is, even if you don't take a single remedy, you are going to be more in tune with yourself. If you write down the fact that all this started to happen when you had this altercation with someone, and the next time you have an altercation with someone, you'll go, dang, I don't need that altercation, out, out, out. So it'll make you so self-aware that you will not get into those problems. And that's a very, very, probably the most important benefit, more than homeopathy even, is knowing yourself. Like if you know, if you do back-to-back travel 3 days in a row, this happens, and you write it down, you will jolly well not do it again if you can help it, you know? Because you don't want to cure what could be easily avoided. And that brings up a very important point for mothers, for pet owners, for garden plant owners, and in the if you're the owner of your own life, your spouse, your partners, friends, keep records. I guarantee you, you're gonna forget. I was sick on so-and-so date, I took aconitum, then that passed, and I had sweats, and I took arsenicum album, then I was very restless and very fearful, I took another dose, or I had food poisoning and I took, you know, arsenicum album, or I reacted to gentamicin, so I took Nux vomica, so-and-so date, write it down. What that'll do is it'll give you a record of what happened, what worked, what did not work, etc. And you can pass that on to your children when they grow up. You keep it for your pets, because with the dogs, I always forget. You know, I forget what worked and what didn't. And so I just keep a spreadsheet. So dates, times, what the event was, what the oddities were. This time the child was feverish and very sleepy, but the last time they were feverish and hyperactive, or they had glassy eyes, or they had dilated pupils, or they couldn't open their eyes. That's a gelsemium state. The time of day, it only happens in spring to my child. And it'll give you clues that'll make you a better sleuth with respect to your health, your family's health. And the other advantage of record keeping is, unlike doctor's records, these are very important. You can pass them on to your child or your grandchild and say, this is what you were like, and this will give them a clue into their future health specifics. I would say keep folders for every member of your family, a different color. I like color-coded folders. And then you can literally take a scrap of paper and write down so-and-so date, had a fever or threw up or got bitten by a tick, and this is what I gave. Super important. And the way to do it is to your children in particular. Don't give it to them until they're ready for it. Teach them, teach, and don't put in acronyms and shortcuts that nobody else can read. Be consistent. So stick to a protocol, date, time first, then the remedy, then the symptoms, or the symptoms and then the remedy, etc. So sometimes I can't read my own handwriting, or I'll have shortcuts that I forget. Avoid making those mistakes, and just write down pertinent things. You don't need to recite the whole life history of that patient, just the current things that are going on. And that's very, very valuable. Do you have any questions?
I have a question. Can you show us an example of, like, you said you have a spreadsheet of what you do?
Sure.
Like
how you love to.
How you keep track?
Yes. Let me show you that.
That'd be awesome.
I will show you my doggy spreadsheet. And so here's my folder. Here is health and nutrition. Here is Sushma. There's Sushma. I think it is. Oh, that's Sushma. And where is the doggies? Let me show you mine. Do you mind if I show you mine?
No, I'd love to see an example because I'm not sure how to keep track of my stuff.
Yes, 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 yes. Where's my daughters? I want to show you my. Maybe it's under health. Health. Might be under health. Sorry, taking a little bit of time. That's recipes. It's got to be somewhere here. Homeopathy, doggies. No. Okay, I know I have a whole bunch here. Let me just go to Sushma and Kailu remedies. No, Kailu. Sushma family test. Maybe this has it. This is our, yeah, this has a lot of stuff in it. This is your standard allopathic. These are the test results. These are additional test results. This is, oh, let's do Richard the best. Okay, Richard. Where was he born? What was his life history? What happened to his back? Then we get to a more current illness. Sick with chest pains, went to ER. They said pericardium was enlarged and da-da-da happened. I gave him flew to Paris and loved it. Aesculus, hippocus, tandem, and arnica for back pain. Constipation took for 3 days. It just has to be as simple as that. Told me 2 days later that he had a sore throat. Men will never tell you. Then, and recently I gave him Rustox and arnica for body aches. He was getting something. Boom, it went away. Symphytum 30C, once for back pain, Heparsof 30C several times for sore throat. Developed slight headache, congestion, blah, 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 miserable and sad. Then let's look at Sushma.
Can you actually share the screen? You know what you're looking at?
Oh, you can't see
Good.
it.
No, can't see
Oh,
it.
No, you cannot see anything beside
Oh,
you.
darn it. Okay, Paris bug. Oh, I'll share this. Okay, sorry about that. Share screen. Where is it? Here. See it now?
Yes,
Okay, so this is what happened. Oh, this is real life. Wednesday, November 25, Sushma, digestive, cramps, loose bowel movements, cramps gone, arsenic amalgam. What did she have? 9C on hand. 9C, cramps, loose bowel, cramps gone, arsenic amalgam, 9C. Then I had itching / oh, that's my daughter. Let's just go to me. Got better. After those cramps, I got better. November 28th, still better. This is my COVID journey, okay? Sushma, on December 2nd, I started getting sneezy, runny nose, no tickles in throat, but feverish, chilly, and weak. I took R-Salb again. Why? Because it worked the last time. Then that's Katie who got sick next, and I used those. Then Sushma had a tickle in her throat, plus runny nose, beginning of chills. I took Merc-Viv, Corellian rubrum, Phos, 1 dose. Then cold was getting chesty, so my cold traveled down to my Kali Carb. I said Kali Carb did not work for me, so it was the wrong remedy. Then I got cotton wool in throat and chest area. It's literally a feeling. And I took Hepar, and it felt good, better. Then I took Hepar 1M. I had an evening aggravation, right tonsil hurting.
lost connection, restarted computer.
Okay, right tonsil was hurting, pains to or behind right ear, no fear. I took Hepar 1M, Then December 8th. And while this was going on, I was fine. Remember that this was going on in the background. I would take the remedy, it would get better. Then I would head out or stay up late with my grandson because he was sick. He had a very whooping cough type thing. And it carried on where I was getting better. Then I would have a sleepless night. Then I would get worse. And then I started finally getting better. My phlegm came out. I was taking Sticta pulmonaria, fell sick, gargles. I got an extra 3 hours of, so there's etiology. I got an extra 3 hours of sleep, immediately better. Sticta, pulmonaria, food, right as rain again, December 13th. Fine during day, at night developed a non-rattling, thin expectoration, cough, and so on. And then it came out. Everything was coming out. I was taking Hepar and Spongia, getting better. And what COVID is a biphasic or triphasic illness. On December 20th, I lost my sense of smell. I took aconitum. When did I take the FOS? Yeah, this is when I took FOS, when I started getting chest, like a snake was around my chest. I took FOS 1M, 4 doses. The snake went away. I went to the homeopath, got up feeling good, made lunch, chest constriction, heart pounding, thought I had aggravated on the aconitum and stopped, took Camphora 1M, felt better, prepared COVID pack, puja, Then I took FOS 1M because I was feeling a snake around my chest. 4 doses, I was right as rain. I flew out of there December 26th. Up until December 24th, I was short of breath, and then it went away. And then I was weeping. That was because I was very tearful. And pulsatilla would have been the remedy, but I don't think I took it, or at least it doesn't say so here. So that's what you write: the date, the name of the person, the problem, the description of the problem, the remedy you took, and this, I've kind of commingled them. But if you're doing a spreadsheet, you can say date, you can say name, you can say condition, short, you can say description, and you can say remedy. And then what you do is you take sort function here, which I am having troubles pulling down, but you can sort this, right? So you can say sort, where is the sort function? Hide and hide, but you can put the sort function and then sort on just sushma, or sort on digestive, or sort on the date, and you will have all your information at your fingertips. I was in it was a lot of stuff going on, so I did 3 people, but I would do them separately. So Richard, for instance, is a separate folder, and I should actually be more organized and just put in the dates and times better. But you get the picture, right, Karen?
Yeah, that's really helpful. Thank you. I've been just doing it on like a, piece of paper, and it looks easier to find stuff to, with the timeline.
Yes.
Just laid out like that. That's good. Thank you.
It's much better with a spreadsheet, simply because you're going to forget whatever the remedy was that worked the last time. And the same remedy seems to work for that person over and over again. So you're creating a database of that person's set of constitutional remedies, or set of acutes, if you will. It's very useful. Any other questions?
I have a question. I lost connection with Zoom about 15 minutes ago. I had to reboot, go through a series of steps as I was about to ask you a question. So I'm going to ask it now.
Okay.
You had some online source, or I think it was repertory, where you were
Yes.
going through and indicating symptoms. I wanted to know what the original source or description or title of that document is.
oorep.com, and you go there and they'll tell you the original sources.
So rep.com?
oorep, orange, Robert, elephant, phosphorus.com. It's a free
Yeah.
remedy, a free repertory. It's got a bunch of things, and the homeopathic people are very generous, very, very generous.
Excellent. Thank you.
Any other questions? No more?
I have a question.
Yep.
Yeah, I do. So when you buy homeopath, like the little containers that the homeopathy is in, it'll say like what it's for. But that's not really the only thing that it's for, right?
Yes, it doesn't say anything at all. That makes zero sense. You got to read
All
it.
right. Because a couple of remedies that you recommended for me last time I saw you, yeah, the description it gave for what it is for was totally different.
Yes.
Okay.
They
good to know.
will say like arnica is for pain or kali carb is for cough, but not really. They're for a whole bunch of other things. Arnica is
Okay.
a great remedy for heart disease. So
Okay. Also, is it possible that you can, like, your symptoms could get worse before they get better once you start taking homeopathy? Because for David's eczema, the thing that he tried the remedy that you recommended, and it got worse. I don't know if it's from that, but it's possible. He's very sensitive to everything, so
yes,
he's kind of afraid to take it. So is
yes,
it?
yes.
No.
That's an aggravation. If it got worse right after taking the remedy's spot on, but it's too high of a potency to use, lower it.
Okay, yeah, that's what I told him to do. Okay.
Much, much, much lower. And there are people who are very sensitive. And the thing is, once you know this, you're going to tell your homeopath or whoever, this guy, David is very sensitive, and they'll do lower potencies.
Okay. One more question. In the Materia Medica, the example you were showing was the arsenicum something, and then in parentheses it said arsenic. So is that a concern, like for somebody? Okay, because like David's arsenic is high, so if I saw that, I'd be like, no, I don't want to give. That doesn't.
In fact, yes, I should repeat the story of the orchardist who used to spray in the old days arsenic on apple trees. And he came to this homeopath, Clark Cooper, with dying of arsenic poisoning. And the remedy he gave him was arsenicum album in a very diluted form, 6 or 12 or something. And his life was saved.
Okay.
It was isopathy. So, but for David, you want to give it in potentized form. It has no molecules of arsenicum, but it'll help detox it.
Okay, so that would be called. Would that be the one that you showed?
No, it would depend on what his symptoms are. But if he had arsenical poisoning, then that's one of the good remedies, actually.
Okay. Yeah, I don't know if. Well, he was tested for heavy metals, and it showed that his arsenic was high, but I don't know if he has symptoms of it. Like sometimes I wonder if that could have something to do with his eczema.
Yes, absolutely, absolutely, it does.
Okay.
Metal poisoning of any sort.
Okay. Okay.
Any other questions?
Sushma, you had on one of your slides to invite friends to join Mary's homeopathy study group.
Yes.
I don't know anything about that.
Okay, please join it. It's on Facebook and it's awesome. Mary is an amazing homeopath, and it's a public service to humanity. And there's, I think, 40 years, and you'll learn a lot about homeopathy there, especially for acute.
Wait, how do you find her, Mary's?
Homeopathy group, Facebook. On Facebook. They have still not kicked her off. No mention of vaccines, no mention of COVID, please. Just homeopathy. The admins are awesome. They're trying to maintain the help they provide to people around the world.
Thank you. Also, I have a question. You mentioned about the vet giving the dog homeopathy. Was that like administered in their water?
Either you can do water, you can pull out their cheek and stick it under their tongue, or however they'll take it. You can put it on top of food. Like someone, Carol said, she wants to take it in an emergency, the vitamin C thing, because that's the only way any way you can get it in is better than not doing it.
Great, thank you.
Typically, you want to do it away from food so that the remedy has a chance to, on a clean mouth, but sometimes you don't have that choice. It'll work. Any other questions?
I just found the link for Mary's homeopathy and put it in the chat if people want it.
Thank you, thank you. Awesome.
Thank you,
Mary,
Susha.
by the way, is a great homeopath. I think she lives in Santa Barbara or somewhere. And, you know, if anyone wants a constitutional, she's an amazing person with 30, 40 years experience, as is Joette Calabrese, as are some of the Indian homeopaths. There's many, many good homeopaths out there.
I have a question. One time when we were talking about COVID, there was going to be a phone tree list. Did that ever happen? Did I just not get it, or it didn't happen yet?
We have to do a
Okay.
phone tree list. Yes, 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 yes.
Okay, okay, just checking, because sometimes I'm not getting things. I'm not sure, like, if I missed it or what's going on. Okay, perfect.
Yes, please, please, yes.
Thank you.
You could just email me your suggestions, because there's so many things I sometimes forget. But if you email me, I will do it.
Okay.
Or set one up on Facebook or something so that everyone is in touch with everybody else. And please join our Facebook group, you know, that way if anything is happening, we'll put it up there and you'll know. I don't want to, because the people who have requested to be on the email list is large and not all of them join. I don't want to spam them with your info or you with their info. So the Facebook group seems to be more active. Or either we could just do these 15 people who attend and do a tree with them. Yeah, that's a better idea.
Mhm.
All right, any other questions? No more questions? Going once, going twice. Thank you, everybody. And
Thank you.
Sushma, thank you so
Thank
much.
you, Sushma.
Thank you so much for everything.
You take
Thank you.
care. Okay, bye-bye.